Nearly 40% of all pickleball-related foot and ankle visits share one diagnosis: not a sprain, not a stress fracture. Achilles tendon rupture. 68% of those occur within a player's first month on the court, and many occur in their very first game. Over 82% of the victims are over 50. This is the injury no one talks about until it's too late, and what's driving it goes deeper than a single bad step. Nearly 2 out of every 5 pickleball foot and ankle injuries seen in clinics are not ankle sprains, not bruises, but full Achilles tendon ruptures. The Kingston study, reviewing 198 consecutive cases, pinned the figure at 39.4%, making Achilles rupture the single most common diagnosis among pickleball players who end up under orthopedic care. This is not a rare or freak event. It's the leading reason players are sent for imaging, surgery, or months of rehab after a day on the court. Most ruptures happen during ordinary movements, running for a drop shot, lunging forward, or planting the foot for a volley. In the Kingston cohort, over 30% occurred during a simple forward lunge, while 16% followed a forceful plant of the foot. The numbers reveal a hidden hazard. For every 5 people limping off the court, 2 will be facing an injury that can end a season or change a life. Mark had been looking for a way to stay active after retirement. Friends told him pickleball was easy on the body, perfect for beginners. On his very first afternoon at the community center, Mark joined a doubles game. He remembers the moment clearly: a quick step forward to reach a low ball, a sudden snap in his heel, and a wave of pain that forced him to the ground. What felt like an innocent misstep turned out to be a complete Achilles tendon rupture. In clinical studies, more than 2/3 of pickleball Achilles ruptures happen within the first month of play. Nearly 1 in 3 occur during a player's very first game. The pattern is consistent across clinics and age groups. Newcomers, especially those over 50, are at the highest risk right as they start. Mark's story is not rare. It is the rule, not the exception, and the numbers from Rothman and Jefferson confirm it. For many, the danger is invisible until it is too late. 82.5% of pickleball Achilles ruptures occur in players over 50. This is not just a quirk of who plays the game. It is a direct reflection of how the aging tendon changes with time. After age 50, the Achilles loses some of its natural resilience. Collagen fibers that once stretched and recoiled easily become stiffer and less able to absorb sudden force. Blood flow to the tendon drops, slowing its ability to repair even minor damage. Microscopic wear accumulates, often without symptoms, until one quick movement is enough to cause a tear. Many people in this age group see themselves as active and fit, not realizing that years of steady use have quietly changed the tissue. The Duke University analysis found that pickleball has the highest share of over 50 Achilles ruptures of any major sport, far outpacing tennis, where only about 1/3 of cases fall in this age group. For older newcomers, the risk is not just theoretical. It is built into the biology of the tendon itself, waiting for the right moment on the court. Orthopedic clinics are now seeing a flood of pickleball injuries that would have been almost unheard of just a few years ago. Between 2019 and 2023, the number of foot and ankle cases tied to pickleball shot up by a factor of 6.5, according to the Kingston review. This is not a trickle, but a surge. It has outpaced the growth of many other recreational sports. The raw numbers mirror the sport's own meteoric rise, with national participation swelling by nearly 1,000% in the same window. Each year brings a new wave of first-time players, many over 50, stepping onto the court and, all too often, into the waiting room. The clinics are not just treating more sprains and bruises. They are grappling with a sharp escalation in severe injuries led by Achilles tendon ruptures that require imaging, surgery, and months of rehabilitation. The pattern is clear. As more people pick up a paddle, the medical system is absorbing the shock. Behind every statistic is another player sidelined, another season cut short, and a growing strain on healthcare resources. A forward lunge to reach a low ball. a sharp plant of the foot to change direction, a quick roll of the ankle during a sidestep. These are the movements that most often snap the Achilles tendon on a pickleball court. The Kingston study mapped out the risk in detail. 30.9% of ruptures traced back to a simple lunge, 16.5% to a forceful plant, and another 15.5% to an awkward inversion. None of these actions are rare or advanced. They are the basic footwork every player uses, from the first serve to the last point. In Mark's case, the injury struck during a textbook lunge, the exact move that tops the chart for Achilles ruptures in pickleball. Biomechanical research explains why. Lunging and planting load the tendon with sudden, high force, especially in older adults whose tissue has lost some spring. The risk does not come from a spectacular dive or a high-speed sprint. It comes from the everyday mechanics of play, repeated over and over, often without any warm-up or preparation. That is what makes this injury so insidious and so preventable. No major medical society has published a validated warm-up or conditioning protocol for pickleball, even as injury numbers climb. The American Academy of Orthopedic Surgeons and the American College of Sports Medicine offer only generic advice: light leg work, some calf raises, maybe a brisk walk, without addressing the specific risks of court movements in older adults. On the official USA Pickleball website, the warm-up checklist is short: high knee steps, butt kicks, calf raises. But this list has never been tested in a clinical study, and there is no evidence it reduces Achilles ruptures, especially for players over 50. Mark, like most newcomers, skipped any structured warm-up before his first game. His story is echoed in clinics across the country. Physical therapists at UT Health suggest a 5-minute dynamic routine, but even this is just a recommendation, not a standard. The gap is clear. There is no sport-specific, age-targeted protocol to address the unique strain pickleball places on the Achilles tendon. The absence of clear, validated guidance leaves players vulnerable to an injury that is both common and, in many cases, preventable. For most players who rupture their Achilles on the pickleball court, the next stop is the operating room. The Rothman and Jefferson series found that 62.8% of these injuries required surgical repair, a rate far higher than for almost any other recreational sport injury. Mark's experience is common. One moment he was lying on the court, and within hours he was on a gurney, waiting for the surgeon. Surgery means more than a few stitches. It involves opening the back of the ankle, suturing the torn ends of the tendon, and weeks of immobilization. The decision is rarely optional. In this age group, non-operative treatment often leads to poor function or re-rupture. The numbers speak for themselves. Nearly 2 out of 3 pickleball Achilles ruptures end with a scalpel. This is not a minor setback. It is a life-altering event that demands months of recovery, physical therapy, and a complete halt to normal activity. Rehabilitation. After Achilles tendon rupture is a long, demanding process that rarely ends with the cast coming off. For most players, including Mark, the journey stretches over months of physical therapy and gradual milestones, first standing, then walking, then relearning how to move without fear. The Rothman and Jefferson outcome study followed patients for nearly 5 years after surgery. At 4.7 years, the average Achilles tendon rupture score was 94.6 out of 100, suggesting that most people regain strong function. But the road back is slow. The typical return to recreational play takes 5 to 7 months, and even then, confidence and speed may lag behind. Small deficits linger in balance and push-off strength, sometimes for years. For Mark, finishing rehab meant more than healing a tendon. It meant accepting the months lost to immobility, the social isolation, and the uncertainty about whether he would ever move freely again. The numbers show that recovery is possible, but the disruption is lasting and often underestimated. Today, Achilles ruptures account for nearly 40% of all pickleball foot and ankle injuries, most occurring in older adults within their very first month. As courts fill and participation soars past 36 million, this risk is not rare. It is real, rising, and too often ignored until recovery comes too late. Stay informed.